Dr. Bilek, and let's see here. So Dr. Bilek is from the University of Michigan. She's a clinical psychologist and a clinical assistant professor at the University of Michigan Department of Psychiatry. Her clinical and research interests center around evidence-based treatments for pediatric emotional disorders. Dr. Bilek is committed to outreach and has given numerous community talks on topics related to anxiety and depression in youth. So let me introduce Dr. Bilek and her talk, Addressing Anxiety and Depression in School-Aged Children.
Just a second to get to my slides. Oops. That's going to take me a few more seconds because I pressed the wrong button. Thank you guys so much for having me. While I wait for my computer to wake back up. Okay. Let's press the right button this time. Okay. Let's see. Just got that for you guys. All right, that looks promising. All right,
Well, it didn't promise to look nice.
yes,
Must be the
that
color.
should go away. I think that will. If it doesn't, just raise your hand. There we go. This looks better. Okay, so welcome. Thanks so much for having me. I'm going to talk today, hopefully quickly, through a few different topics that I thought would be helpful based on, Elena and I had a conversation about what you guys might really be most interested in hearing about. So we'll talk a little bit about the signs and symptoms of anxiety and depression in youth, what skills might be useful for students, but also I just think of these as skills that are helpful for everyone, so maybe hopefully you'll benefit from them as well. How to assist with a referral. I think that you guys are in a unique position where you have very long-standing relationships with some students, so you might notice changes, and then that can put you in an awkward position. Do you say something? Do you not? So we'll talk a little bit about that, and hopefully have some time to answer questions. One thing I want to just, I think it probably goes without saying, but really reiterate is that you guys are their teachers, you're not their mental health professionals, so I don't want you to take away from this talk that you have to feel like you can diagnose or treat anxiety or depression in youth. I want to give you some of the things that I think about as a clinician when I am diagnosing or treating anxiety in youth and depression in youth, but I don't think that that's too much of a burden to put on you. You guys have plenty of other responsibilities, but again, I think that some of these things can be useful for anyone to be thinking about. So, why are we talking about this? Anxiety and depression are probably among the most prevalent mental health concerns among youth. Anxiety, by the time teens hit the age of 18, 25% will have a clinical anxiety disorder. And of course we know that some level of anxiety or anxious feelings are just part of the human experience. So any teen is going to have worries, nervousness, anxiety, fear at some point. It's just natural. In terms of clinical depression, we would say that in the adolescent period, as many as 12.5% will experience clinical depression, and certainly that's much more prevalent in females than in males. So what are the signs and symptoms? What does it look like? We'll talk a little bit more about this cycle later, but when we think about emotional disorders, we would think about the fact that there are these components, these thought components, physiological components, and behavioral components that are part and parcel of emotional disorders like anxiety and depression. So we'll talk about some of the specific ways that they interact a little bit later, but for now we're going to go into some more depth about the specific types of symptoms you would see. First, with thoughts. So thoughts are another way of saying cognitive symptoms. These, I don't know if you can see them, but in the little bubbles here, we have, sorry, I think I'm getting emails and it's making all this noise. Okay, in the little bubbles, we have what we call cognitive distortions. So basically, the way that we view the world is completely influenced by our thoughts, or our perception, or our bias. And individuals with anxiety and depression are much more vulnerable to having negative bias or perception, or I almost, when I talk about it with children, I think of it as like a lens. Imagine that you put on a pair of blue sunglasses. After a while, you adjust to that and you just think that this is kind of how the world looks, right? This is what happens when you have anxiety and depression. It's almost the lens that you look through the world is just a little bit distorted, and you don't notice that that's distorted, right? So they have these cognitive distortions that contribute to their distress, of course. Some of the names, there's always fun names in psychology, so some of the names for these cognitive distortions are things like magical thinking, all or nothing thinking, jumping to conclusions, catastrophizing. You might see any of these in anxiety or depression. What do they mean? We don't have to go through all of them, but some examples of things, all or nothing thinking, that's that rigid thinking where you only see things in black or white, you don't see the shades of gray, you don't see things as very nuanced. That is also part of the teenage experience. That's just what it means to be a teenager. But when it starts to get in the way is when you are so rigid about things that it ends up causing you distress or impairment. Magical thinking is sort of thinking that what you're feeling can kind of impact the world, or that, you know, certainly in things like OCD, we might see people believing that having a thought is going to create an outcome, sort of like, oh my gosh, I had the thought that my mother is going to die, I must do something to make sure that doesn't happen. Catastrophizing and jumping to conclusions are more along the lines of thinking the worst, assuming that something much worse is going to happen, or that a low probability event is going to occur. Physiological symptoms that might go along with depression or anxiety include, especially the anxiety, sort of these panic symptoms, things like difficulty breathing, heart racing, feeling sweaty, feeling dizzy, having difficulty really focusing or concentrating. Again, these can also blend into depression. Fatigue, slowness, those are ones that come along with depression. I think of the behaviors, though, as the big one, because certainly, thoughts and feelings can cause us distress, but the way that they impact, the sort of anxiety and depression impacts us the most is when it really bleeds into our behavior and how we live our lives. So the big behaviors that go along with anxiety and depression tend to fall within this umbrella avoidance category. And I think of it as things like withdrawal from the world, from friends, from people that you care about, from activities that you care about, which we'll talk more about later, or in that anxiety setting of avoiding specific events that cause you anxiety, or slowly just staying more and more within your comfort zone, and then your comfort zone gets smaller and smaller. And we'll also talk about how reassurance seeking or continually asking for positive feedback or reassurance can also fall into that category. So what types of things do teens and children worry about or have anxiety about? I just started brainstorming some things that I see in the kids that I work with. So some kids at work worry a lot about getting in trouble, being excluded. Lots of different things to worry about when you're a kid, right? And these are just a handful of things that came to mind for me. Okay.
I think they all bother us.
Yeah, well, and it's, again, when I say it's a part of the human experience, I think it is normal to be worried about these things. It's very common. But these are the content that you might see in terms of more elevated anxiety. And I'm sure these are just a few of the things that might come up. How does depression sort of come across or present in teens or children? So this is from a website that talks about mental health in the schools, which I thought was, a little bit related since you guys have a teaching relationship with your students. But some of these may not be the perfect fit because it's sort of how does depression present in the school, which may be a little different than the relationship that you have with students. But things that you might see in adolescence for depression: low self-esteem, Irritability is a big symptom of depression in youth that is not always captured or thought about, because we mostly think of it as being down and withdrawn, but it can also present as that sort of grumpiness or irritability. Negative perceptions of yourself in the past and present, rejection, boredom, that's another big one. Loss of interest in activities that you used to enjoy, which is, I think, also relevant. And then impulsive and risky behavior, again, might be harder to view through that depression lens, but when you are losing interest in the things you used to enjoy and that down mood is coming more and more, people do maybe more extreme things to try and get positive feelings, which obviously can lead to risk. All right, but before we move on, like I said, it's important to cultivate mental health for yourself and to make your lessons with your students a place where mental health, if you're not actively discussing mental health, at least making it a mental healthy environment. So one thing that you can do that's very brief and can for yourself center in a moment of stress or distress is just a simple body scan. And I have in the handout at the very end a link to a YouTube video for it. You can always look those up. But we can just do one here now because they don't have to be complicated. So if you want to just get comfortable in your seat, you can either lower your gaze to look at the floor or close your eyes. Kind of shake out some of the wigglies. And then I usually try and think of it as if there's an eye on my forehead, a third eye. And I'm just going to use it to scan through my body, starting at the top of my head. And as I'm scanning, I'm looking for areas of tension or discomfort or especially stress. And I'm going to take a moment to notice them, try not to have any judgment towards them, and release the tension if possible. Oftentimes, as I'm going down my head, I notice that my forehead is wrinkled or tense. My eyes might be clenched. Just letting that all go. Especially my jaw, I tend to hold tension in my jaw. So relaxing your jaw, keeping your lips closed, but your jaw open. And then you just take that third eye and slowly move down to your shoulders and your neck. Are you holding any tension there? You can release through your arms and your hands, through your chest and your belly, through your thighs and your legs, and all the way down through your feet. Take a moment just to notice your breath. And let out, as you breathe out, let out any lingering tension or stress. And then when you're ready, you can return to the room and open your eyes. So I think that probably took us all of 1 minute, and it's a nice way to kind of center before an activity where you as a teacher have to be on, or where a student may have tension or stress, maybe before a performance. I often teach my clients to do this before tests, especially those patients who tell me that their mind goes blank the second they sit in look at a test. That can be a very private activity that doesn't bring attention to yourself. So I think that some people like to do that because they don't feel like, oh, everyone will notice that I'm doing a body scan. It's very quiet and private, and it allows you to center your mind and refocus and let go of some lingering stress. So that's something you can add to your practice and potentially assist students with. Again, this is something that everyone can practice. It doesn't have to be focused on individuals with mental health concerns. So now we're starting to move into that realm of practical tools. What can you use? So again, there's these two buckets. There's things that could be helpful for all of your students, things that I just think are helpful for every person. And that can be just, again, creating an environment that is healthy, and also understanding healthy strategies for managing emotions, because we all do, as people were pointing out, we all have anxiety, we all have stress, and we all do unhealthy things, even if we're not mentally ill. So it's good to recognize those strategies and guide people in more positive directions. But what to do when someone's at risk? What should you do how do you talk to someone about anxiety and depression, especially if they bring it up? What are ways to be effective listeners? And then what should you do if you're really noticing something quite concerning? Again, that puts you in an awkward position as you sort of have a different kind of role in their lives. So coming back to our circle, I said we return here. Emotions have 3 interacting parts. These arrows only go in one direction because that's the only thing I could figure out how to do in PowerPoint, but they should go both ways. We often choose unhelpful ways to deal with our uncomfortable emotions. So I usually like to give an example with this, and one that I often use is a younger child, maybe in elementary school, who is invited to her cousin's birthday party. So she doesn't go to school with these kids, she doesn't know them very well. Really the only person she's going to know at this birthday party is her cousin. And that makes her feel extremely anxious. She has the thought of, I won't know anyone, I'm not going to enjoy it, I'm going to feel uncomfortable the whole time. Everyone's going to be talking without me, I'm not going to know how to enter the conversation, and I just don't think I can handle that. So she has feelings in her body that probably arise from that, butterflies in her stomach, I hear from a lot of kids, or maybe her throat feels dry when she manages going to it, her heart races. That's pretty individual what that might be for that child. So the behavior, what's that going to lead to? A lot of different things, but I can imagine her deciding to cancel, telling mom I feel sick, which might be true, right? The butterflies in her stomach, but she might decide to stay home and not go. And this is where it becomes a circle. So the next time she gets invited to her cousin's birthday party, or maybe even someone else's birthday party, because these things generalize really quickly, our brains are very quick learners, she's probably going to be more anxious the next time an opportunity like this comes up, because our brains learn, I couldn't cope with it last time, I chose to avoid, so I won't be able to cope with it this time. And so her anxiety will either stay the same or get more intense over time if she continues to avoid. So again, thoughts and feelings, the cognitive distortions, the physiological symptoms of anxiety or depression, they are uncomfortable and a nuisance. But when it really starts to get in the way for most people is when they start to engage in unhelpful or unhealthy behaviors. The ones that we see a lot with anxiety and depression are things related to emotional eating or procrastination, putting things off that you have to do, distracting yourself in the moment, withdrawal. And again, I think I mentioned this before, that all in my mind falls under this umbrella of avoidance. When you just can't cope with that feeling of down mood or anxiety or distress, when you're so accustomed to feeling something and pushing it away and going in a different direction of that feeling, then it's going to become habitually the way that you respond, and it's also going to lead to impairment in your life. So those are the things to look out for, are subtle and overt avoidance behaviors. And I like to talk about avoidance in more depth because I think that this is pretty insidious, because at first glance it's not really a problem, and there are times when we all choose to avoid and it's fine, right? I don't want you to all go home and reanalyze your lives and think, I avoid something, that's normal. We avoid things from time to time. Distraction can be a helpful tool for getting through difficult things that you need to get through. The problem with avoidance is when it starts to get in the way, and when it kind of becomes a cascade. So if you think about life for you or your students as a multi-lane highway, and you're driving your car, you can just choose anywhere you want to go, there's no traffic, right? And that's really nice. You have lots of avenues open to you of how you live your life or how you do things that matter to you. And then something comes up and you decide to avoid it. Not really a big deal, you've still got 4 or 5 lanes to move between. But like I said, once you avoid something once, our brains learn really, really quickly that worked, right? We get